another Facebook Live conversation with the Train with Trust Project and Dr. Sue Dyson. I am Megan Phillips of the Train with Trust Project, here with Jody Ambrose, also of the Train with Trust Project. And we are a nonprofit organization dedicated to sharing animal behavior information, making animal behavior information accessible for everyone, and sharing evidence-based practices in animal care. Today, we are going to be discussing the proper application of the Ridden Horse Pain Ethogram, or also called the Ridden Horse Checklist, as well as the checklist of additional behaviors that one can observe that may indicate early signs of lameness or early signs that something is wrong. And so this is a topic we've been asked a lot about, and Dr. Sue gets questions about all the time. So we're really excited to share this information with you to make this tool really practical and useful for everyone. So with that, I'm going to go ahead and turn things over to Jody to get our conversation started.
Okay, so good morning. And I'm going to go ahead and ask Dr. Dyson right off the bat, can you give a very brief explanation of what the Ridden Horse Pain Ethogram is and why sometimes people might see it called different things?
It's basically a list of 24 behaviors, each of which have strict definitions, like, for example, mouth open with separation of the teeth for 10 seconds or more. There are 24 behaviors. And if a horse displays 8 or more of those behaviors during a work period of between, say, 5 and 10 minutes, then we know it must have some source of pain. It doesn't tell us where the pain is coming from, but it tells us unquestionably that horse is experiencing discomfort. We want to encourage people to use this as a regular monitoring tool. And some people find that the term pain is a little bit of a switch off. So we find that some people prefer to refer to it as the Ridden Horse Performance Checklist, because we know that comfort and performance go hand in hand. So it doesn't really matter what we call it, it's one and the same thing. And it's really important to recognize that each of the individual behaviors, for example, repeated tail swishing, could have one of a number of different reasons, which is why it is the total score out of 24 that is important.
Yeah, I would also add to that I think it's a great tool for determining when your horse isn't in pain. If I think sometimes people are afraid to actually go down this path because they feel like, once you start going down that path, it means that the problem is going to be pain, and it's going to mean big vet bills, or it's going to mean that your horse is not going to be able to be ridden, or the problem isn't going to be fixable. And what you're talking about, using it as a routine method of evaluation, is a great way to diagnose early if there is a problem, but also to determine if your horse is happy. And we've done Facebook Lives on what a happy horse looks like and what a horse that's not in pain might look like. And this is a great tool for that as well. So I think the two different names may help people understand that a little bit better.
Yes, I think so. I would very much encourage using it as a regular monitoring tool and reassuring yourself that it can tell you that your horse is okay. And it can also help you to differentiate between a training problem and a pain-related problem, because when we're teaching a horse new movements, it may show some behaviors which are not usual for that horse, but we would not expect to see 8 or more of the behaviors unless the horse was experiencing discomfort. So I think that's a valuable way of using it as well, to say, yes, the score has gone up over the last several days as I've been teaching the horse, for example, to do half pass, but it's never reached that threshold of 8. And then as the horse finds the work more easy to understand, becomes more familiar with the movement, we would expect the score to come down back to baseline. So it's a good tool in that respect. And I would also suggest that if you're thinking of buying a horse, think about using the tool when you're assessing the horse, because whatever the vendor might say about your riding, if this horse is displaying 8 or more of the behaviors, that's not down to how you're riding the horse. It's down to the fact that the horse has got discomfort. And I think it gives you assurance as to what it is in front of you in terms of, is this horse worth buying or not? And it can help you if you've had difficulties having a conversation with your veterinary surgeon about whether or not the horse does have or does not have a problem. They may say they can't see any lameness, but if you can say to them, well, actually, it scores 9 out of 24, there must be discomfort, it's a tool that you can use to persuade them to investigate further.
And to clarify, this is not just a tool for lay people, for trainers or owners. This is also something that you recommend veterinarians are.
Oh, absolutely, because I think as a veterinarian, it's really helpful to help me determine if a horse has got musculoskeletal pain. And if I'm then investigating by the use of nerve blocks, I'm expecting to go from, say, a score of 11 out of 24 down to around 3 or 4 out of 24. And if I only get it down to 7 or 8, that makes me think I must be missing something. I've got to investigate further. So I find it hugely valuable during clinical investigation. It may make me look closer at the saddle fit, for example, because one of the reasons why, although I may abolish the lameness, the score remains too high because the saddle is creating discomfort. And I think it's useful as a tool, be it as a veterinarian or a trainer or a physiotherapist, if you've got to address that thorny issue as to whether or not the rider may be too big for the horse. This is a kind of tool that you can use to say, well, this horse rider combination of experience, the horse is experiencing discomfort. And we know that from the score. And it gives a more objective way of addressing that issue of the mismatch between the horse and the rider.
Yeah, I think as a trainer, that's been really helpful for me, regardless of the reason, to be able to evaluate a horse's comfort level between different riders. Often we have a sense that, like, oh, this horse does this for the trainer, but won't do this for the owner, that sort of thing. This really gives you a way to measure that and be less emotional about the issue. And that, I think that was the real light bulb moment for me, was this is a way that I can communicate to my clients, the difference between these circumstances, when I ride or when they ride, or when the horse is having an issue versus on their good days, that kind of thing. And it's not so much of a guessing game. It gives you a real concrete way to communicate between yourselves. And that's one of the things that has been really helpful to me. And I'll just throw in a little plug for the film, 24 Behaviors of the Ridden Horse in Pain, because I think one of the things it does brilliantly is really demonstrates how that process happens during a veterinary evaluation and how things are ruled out versus ruled in. And so if anybody's watching that hasn't seen the film, it's on our Facebook page, and highly recommend watching that. So Megan, can you throw up a slide? I want to talk about what you need to know before you even start using the ethogram.
Well, but first of all, you need to look at the surface on which the horse is being worked. Because if the footing is very deep, then even a normal horse may kick the surface and appear as though it's got a toe drag. And that is just because the surface is too deep. But if we look at this horse on the right, this is on a gel track surface, which is a beautiful surface, and yet the horse is kicking up the surface, reflecting that it has a genuine bilateral hind limb toe drag. So we have to look at the surface first. One of the behaviors is exposure of the white of the eye, the sclera. And what we have to realize is that in some horses, we can see the white of the eye at rest. So in the grey horse on the left, we can see the white of the eye in the right eye, but not in the left eye. That means we can apply the behavior exposure of the sclera repeatedly to the left eye, but we can't do it to the right eye. One of the other behaviors is the bit being pulled through repeatedly to one side of the horse's mouth. And you may get a false impression of this if the canons of the bit are too wide, so the overall width of the bit is too wide. Even if it is too wide, if you look carefully, you will be able to determine whether or not there's a difference between how much of the bit you can see on the left side of the horse's head versus the right side. But you need to be aware in advance of the width of the bit. And also, I think because a bridle can in itself cause discomfort, either by the fitting of the headpiece or the brow band, or the proximity of the buckles to the temporomandibular joint, we need to look generally at the fit of the bridle for the horse, because if the bridle is uncomfortable, that may promote things like the horse tilting its head or head tossing up and down, which are also behaviors in the checklist. So assessment of bridle fit is also important. And if we go on to the next slide, one other thing we need to be aware of is that we have a number of the behaviors which are related to movement of the head, opening of the mouth, exposure of the tongue, anything which is causing discomfort within the mouth, within the oral cavity, could provoke those behaviors. So we need to be aware as to whether or not there are any abnormalities in the mouth that could create discomfort. So if we look at the middle picture, we can see this large crack at the commissures of the horse's mouth, and clearly that's likely to cause discomfort. Similarly, in the picture on the right, we can see that there are sharp outside edges to the upper cheek teeth, which have created this deep erosion in the lining membrane of the cheek, and that too is going to create discomfort and is likely to create alterations in the stability of the head and the posture of the head during ridden exercise. We also need to look at the bit, because some bits have got rough edges which can also create discomfort, or with a loose ring snaffle, the ring may be creating some pinching at the corners of the horse's mouth. So these are all things that we need to be aware of before we get started seeing the horse ridden.
Yeah, I would jump in and say that I think that's one of the most often missed things that I come across, because other than when people have dental work done on their horses' mouths, they really don't look inside their mouths that often, and frequently are not able to really get in there and look around in their mouth. And that's one of the reasons why in our behavior education, we really encourage people to train behavior for husbandry, like being able to open the mouth and hold it open, shine a light in there. I've even found a little camera that I have that I can plug into my iPhone, where I can look around in there with a light on it. And it takes a little bit of time, but it's really worth teaching your horse to cooperate with the process of looking inside the mouth, and it's not that hard to do, because they're so delicate, and we do, there's obviously so much conversation about bits and what harm bits can do. If you're using a bit, you have a responsibility to, pay attention to what's happening in the whole horse, including inside their mouths.
Absolutely. And I would say, going back to the behavior, that the saying, don't break your vet, is so important in terms of training your horse such that it is amenable to the majority of veterinary interventions.
Absolutely. We really encourage veterinarians to make their clients aware that that is an important step and that it's something that can be done. I think a lot of people don't realize that. And if people have questions about cooperative care, they can contact us at Train with Trust Project through our Facebook or Instagram, and we can help you get on that path to training for for cooperative care, because it really makes a difference in the quality of life for your horse. But like you said, also makes your vet's job safer, more efficient, easier, and your vet's going to be a lot more inclined to go the extra mile for you if your horse is cooperative.
Yeah.
So let's see.
So yes, timing of the behaviors. And when you're beginning, I think that you need to time the period for which you see some of the behaviors. Quite a number of the behaviors are time dependent. So for example, mouth opening with separation of the teeth has to be present for 10 seconds or more. Ears being back behind a vertical position, as we see with the grey horse on the right, the behavior has to be seen for 5 seconds or more. Likewise, this horse, the grey horse, shows an intense stare or glazed expression, and that's a behavior that we have to observe for 5 seconds or more. The head being behind a vertical position 10 degrees or more has to be present for 10 seconds or more. Once you are familiar with using the tool, then it becomes more intuitive in terms of how long a behavior has been present. But I think when you're starting out, then it's really valuable to time the period for which that behavior is shown.
Can you talk real quick about just a little bit more specifically about the eye, the glazed eye behavior and what you look for?
Yes, if you look at a normal horse, you will see that it has an engaged expression. It looks as though it's reactive to its surroundings, and is taking an interest in its surroundings. Whereas the horse on the right has this kind of blank expression, an intense stare, looking zoned out, really not focusing on anything specific. And that is what is an intense stare. That's a good example of an intense stare.
I think that would be another great topic to show contrast between horses that do have that engaged eye and that glazed stare.
Yes. The intense stare is one of the most, or it is the most frequent behavior of the 24 that we see in horses with musculoskeletal discomfort. So it is something important to recognize.
That's really
and I think some of the horses with chronic discomfort will even look like this in the stall. So you go into the stall and they don't react to you. Even if they're taken to a clinic in a strange environment, a new environment, they still have this rather blank expression in their eye, which is not normal.
Yeah, that's really interesting. And you saying it's not normal, I think, is interesting because, you know, when I use the 24 behaviors, I just anecdotally was thinking that is the most common behavior I see. But because I, am not as experienced as you are, it made me wonder, am I over diagnosing it? Am I seeing it more than it's really there? Because I see it so often that
I would say it's one of the more difficult things that people find to appreciate. And I find very, very few people who overinterpret. They're much more likely to underinterpret this specific behavior.
Yeah, I think that's a really good point. I've never heard you say that before, and that's very helpful to me.
Okay, so shall we go on to the next slide? I think it's really important to use a checklist, and don't be shy about using a checklist, because you're not going to remember all the 24 behaviors. So you can keep referring back to the behaviors. And because some of the definitions are repeated head tilt, for example, I would always put a little tick on the line the first time I saw it, and then watch it again, and then put another tick if I see it again, and another tick if I see it again, and then I can be absolutely sure that it's repeated. Likewise with tail swishing, the definition is repeated tail swishing. So we need to observe it, make a little tick when we see it the first time, and then repeat those ticks if we see it again and again. And I think it's also helpful to make a comment about under what circumstances you see a behavior. So, for example, you may see that the head is behind a vertical position for 10 seconds or more for more than 10 degrees in canter more than in trot. So I would put especially in canter. So just so I'm aware of the circumstances under which I'm observing a behavior. I also think that it's important that we are aware that if a horse has been trained to a certain level, it may be quite comfortable in working trots and working canter, and it may be only when it's asked to do more collected movements or those movements which are biomechanically more demanding that the horse begins to display signs of discomfort. So just because a horse can trot around the periphery of the arena, do a nice transition to canter, and then canter around the arena, it doesn't mean it's necessarily pain-free. We need to see the horse perform its full repertoire of movements. So if it's a Grand Prix dressage horse, it's got to do all the movements that they may be required to do in the Grand Prix test. And I think, should we go on to the next slide? Yeah, I think it's important to realize that we can do this observation at in any place. It doesn't have to be done in an arena, but what you do need to know is that you need to be able to observe the horse from all perspectives. So if the horse is working on the left rein, I would stand in the blue corner between A and F, so that I can see the horse go away from me, from the side, and then back towards me. And then when the horse works on the right rein, I'm going to switch to the yellow corner. So again, I can see the horse move away from me, from the side, and back towards me. And that's important because you can't assess things like, is the horse moving on 3 tracks? If you're not standing directly in front of the horse or directly behind the horse. You can't properly evaluate a crooked tail or a head tilt unless you're seeing the horse come towards you or moving away from you with respect to the crooked tail. So it is important that we look at the horse from all perspectives. I've already said that we need to watch the horse for between 5 and 10 minutes, and we've actually designed a kind of simple dressage type test which lasts for about 8.5 minutes, which involves walk, trot, canter and transitions and circles of 20 meters and 10 meters diameter. And the transitions come on quite quickly, and this is also important because the more difficult we make the maneuvers, the more likely we are to create some degree of discomfort in the horse. And we're trying to not put the horse in an unfamiliar situation, but put it in a situation when it's performing movements which are biomechanically more difficult. Then we have to be aware of features of the horse which make things potentially more difficult to see. So, for example, if the horse produces a lot of froth in its mouth and so has a lot of white around the lips, that can make it quite difficult to determine if the horse actually opens its mouth with separation of the teeth, because you may be able to see movement of the lips, but opening of the mouth wide may be disguised. Similarly, if the horse has got a pink muzzle or a white muzzle, it may be difficult to detect the tongue moving quickly in and out. If the tongue hangs out all the time, that's easy to see. But if it just pops in and out, you may miss that if there's a lot of froth around the mouth. And I think you need to differentiate between horses which retract the lips and therefore expose the gums. That does not fulfill the definition of mouth opening. For mouth opening, we have to see separation of the teeth for 10 seconds or more. We can look at video recordings of horses and make a judgment on their behavior, but those video recordings have to be of good enough quality. And that means the horse must be filling the frame, which is easy using an iPhone, for example, when the horse is close to, but you have to be able to change the settings so that you can zoom in on the horse so that the horse continues to fill the frame of the camera when it is further away. Because if it's just a dot at the end of the arena, you're not going to be able to make an accurate judgment.
Mm-hmm.
And I would also say that I looked at about recordings of about 100 horses on my phone, and then looked at the same horses on my laptop. And I realized by looking on the phone with a small screen, I was missing behaviors. So I think it is well worthwhile transferring videos to a laptop so that you can look at the videos in a bigger screen.
That's a great point.
Should we go to the next slide? I think that it's really valuable to see the horse ridden in rising trot in 10-meter diameter circles to the left and to the right. And it's important that they are only of 10 meters diameter, because 12 meters is too easy for the horse. If we stick to 10 meters and we make them complete circles, so it's not a figure of 8, it's a circle to a circle. So in dressage terms, it's a vault to a vault. This is quite demanding for horses, and it's a very good way of making them display discomfort if they are uncomfortable, and also accentuating their behaviors. So often you will see that, particularly in the change of direction from left to right or from right to left, that you will see there is a change in the horse's head and neck position. The horse may become further behind the bit, or it may toss its head, or it may tilt the head. And if we see that repeatedly, those are behaviors that we should be paying attention to. Whenever we're looking at the horse, I'm also aware about how the rider can confuse the issue sometimes. So, for example, if the rider finds it difficult to keep their hands still in rising trot, they may induce side-to-side movement of the horse's head. And if, as a trainer, you're observing this, or as a vet, you're observing this, then I would always say, ask the rider to go on a long rein and see what happens. And also ask the rider to put their hands on the horse's neck or grab the mane in order to keep their hands still, so that we see if the horse's head becomes more still when the rider's arms and hands are more still, because they can create confusion. And also, I think, particularly when I see horses ridden in double bridles by more advanced dressage riders, sometimes we will see that there's mouth opening, which seems to be in synchrony, particularly in collected trot or piaffe or passage, that the mouth opens in synchrony with a slight upwards and backwards movement of the rider's hands. So we need to be aware of the circumstances under which the horse is showing these behaviors and relate it to what the rider is doing. Similarly, we will see some horses who will tail swish in synchrony with the application of spur cues. Mm-hmm. And that needs to be taken into account. If it's only swishing its tail when a spur cue is applied, then that is a direct response to the spur cue and is not a reflection of underlying primary discomfort which the horse is experiencing. It's a response to the spur cue. So we need to differentiate between spontaneous swishing of the tail, because that's a reaction to the situation in which the horse is in, versus tail swishing, which is a direct response to application of a spur cue. And when we're looking at the horse moving in these small circles, I think there are a number of features that we need to be thinking about, because sometimes the horse will alter in its rhythm. It may go slower or it may accelerate. And one of the behaviors is repeated changes of rhythm or speed. So this is something to be aware of when you're seeing the small circles. And I think we've got some photographs on the next slide. Oh, yes. Does the horse maintain the same outline? When we look at this horse, we can go on to the next one. When the horse is going to the left, we can see that its head is in approximately vertical position. The mouth is shut. We can see a slight toe drag of the left hind limb. But when this same horse is going to the right, we can see that the tail is held to the right. The horse's mouth has become open with separation of the teeth. And we also see that the front of the head has become in front of a vertical position. It's not in front more than 30 degrees, but there is a change in the horse's overall posture. And a normal horse should look similar on the left and right small circles, but this horse does not. So this is an example of how behaviors can change going in small circles to the left versus to the right. This is just an example of the fact that we can apply this checklist to horses from any discipline. It's not just restricted to horses that do dressage or an event horse or a pleasure horse. They can be used for reining horses as well. And this reining horse is showing one of the behaviors, which is eye closure for between 2 and 5 seconds. The horse's head is also slightly behind a vertical position. And notice that there is no rein tension. This head position is not being created by the rider. The horse has put its head there voluntarily. That's where it wants to be. Now, it could be trained, because I know that in these Western pleasure horses, they like to have a low neck carriage. But this horse's head is behind the vertical, and this horse's head was behind the vertical all the time during the ridden exercise. Okay, let's go to the next slide. People say, well, is there any difference if we change the tack? And there will be some horses when I'm suspicious that a restrictive noseband may be stopping the horse opening its mouth for 10 seconds or more with separation of the teeth. And in those circumstances, I will either loosen the noseband or I will remove the noseband to see if that allows that behavior to be shown. We can see that this horse is being ridden in a bitless bridle. The question is, does this remove some of the oral behaviors? Will it remove the tendency for the tongue to be out or for the mouth to be open for 10 seconds or more? And my experience is the answer is no. Horses, even without a bit in their mouths, will still display, potentially display those behaviors.
That has interesting implications for the whole conversation about bits and bitless bridles.
Yes, I think people tend to think that being bitless is potentially kinder, but you have to think about the pressures that are applied over the nose by the hackamore of whatever design. Mm-hmm. And in some designs of hackamore, those pressures are very high. So it's not necessarily a more user-friendly setup than having a correctly fitted bit. And everything relates also to how the rider applies their cues, of course. Mm-hmm. Because if the rider is exerting too strong a rein pressure or tension, then that in itself can potentially create discomfort.
We did a whole discussion on bits and bitless bridles that people can also find on our Facebook and our YouTube channel. Maybe we'll repost that for people that want to hear more about your take on that.
So when we developed the checklist or the ethogram, we did so based on video recordings and the reliability with which sound could be heard, particularly when the horse was at the far end of the arena away from the video camera, meant that we couldn't, in the development of the ethogram, think about noises. But I think it's important to recognize that there are some noises that we see with greater frequency, or hear with greater frequency, I should say, in horses with discomfort than those without discomfort. And if I hear a horse repeatedly grinding its teeth or chomping repeatedly on its teeth, then that, to me, is a sign of the likely presence of discomfort. Similarly, there will be some horses that will make a respiratory noise when they are more uncomfortable. And that noise may sound like and we tend to see that probably more in horses which are uncomfortable in canter than we do in trot. And it is often markedly reduced when we take away the horse's pain. So we know that it is a direct response to discomfort. We also have to realize that if a horse has got its head away behind the vertical position, that will result in some compression of the soft tissues in the region of the pharynx and also compression of the trachea or the windpipe. So that may result in impaired airflow that can potentially create some degree of respiratory distress and may create some respiratory noise. Some of the other features that we need to think about are the respiratory rate. The respiratory rate during work and immediately after work has stopped. The normal horse's resting respiratory rate is between 12 and 15 breaths per minute. And after exercise, the horse should relatively rapidly return to the resting respiratory rate. If it has a delayed return to the resting respiratory rate, or you see during when the work has finished that there's excessive movement of the flanks and the side of the thorax, relative to the amount of work that the horse has done and its fitness and the environmental conditions like the heat and humidity, then that's not normal. That is also a reflection of the likely presence of discomfort. Similarly, if we see excessive sweating relative to the environmental temperature and humidity and the work intensity and the horse's fitness, that also is a potential sign of discomfort. And we can see that in this horse here, this horse has just finished exercise. This was a fairly fit event horse, but we can see it sweating a lot on its neck, in front of and behind the saddle in the girth region, around the top of the hind legs. It was also sweating profusely between the hind legs. That's not normal. And also you can see that this horse as well has got a glazed expression in its eye. It's not engaging with the environment. One other thing to note about this horse is if you look at the patch underneath the front of the saddle, the area underneath the front of the saddle is dry. And that tells me that the front of the saddle, particularly the tree points, are creating excessive pressure underneath the front of the saddle. So that dry patch is a really good clue that the saddle is not fitting appropriately and is probably contributing to discomfort. If horses are uncomfortable, they will be experiencing a stress response. And we all know when we're stressed that may change our frequency of defecation and the consistency of the feces. So if the horse keeps passing droppings, and particularly if those droppings are abnormally soft, that's a reflection of stress, which may reflect the fact that it's got underlying discomfort. People say that there are some horses that are very tense individuals and tend to be hyperreactive to cues. I think most of these horses have got some degree of underlying stress, generally due to discomfort. And when we take away their discomfort, they are less reactive to the cues. they are less sensitive to the cues. They're not being hyperreactive, and they may work in a more relaxed frame. Instead of having a really short neck, they may extend their neck spontaneously. And another thing that we can't really measure, or we could if we use rein tension gauges, but we cannot otherwise. But we can by asking the rider, and we also can see by observing the tension in the reins, is what is the contact that the horse is taking? Is the horse avoiding taking a contact? So actually there's a slight loop in the rein. Or does the horse lean on the bit because it's excessively loading the front end? Or is there asymmetry in rein tension? So does the rider complain that she's got a much stronger feel through her right arm than she does through her left? All of these are not normal. A normal horse should take an even rein contact, and it should take the bit. It shouldn't spontaneously put its head behind the vertical, avoiding any rein tension. So these are all things that are frequently a reflection of discomfort. And if we take away their discomfort, then we will see a change. The horse will become more rideable. It will respond better to the cues. It will take a more even rein tension. It won't sweat as much. It won't make the respiratory noise. It'll stop grinding its teeth. So all of these things are important to be aware of. One other thing we need to look at is the horse's posture after exercise. This horse is standing with the forelimbs and hind limbs in a reasonably normal position. But if we see, once the rider has got off, or when the rider is still on the horse and the horse is standing still and they may be talking to a friend or talking to a trainer, and the horse keeps shifting its weight or stands with its back extended and its hind limbs stretched backwards or its forelimbs stretched forwards, those are not normal postures, and they are a reflection of the horse being uncomfortable. And these are all things that we should be aware of. I talked about the absence of sweat under the front of the saddle with this horse here. I would also recommend inspection of the back after removal of the saddle, because if the saddle is moving abnormally, it can create ruffling of the hair, or it can even create soft tissue swellings, which are transient in nature, which are quite close to the top line, and they particularly occur underneath the middle of the saddle, and that reflects the fact that the saddle is creating a problem, and saddle fit needs to be addressed. And that applies even if the saddle has been recently evaluated by a professional saddle fitter. Mm-hmm. Just because the saddle fit has been assessed, in my experience, doesn't mean that the saddle does fit appropriately, unfortunately.
Mm-hmm.
So let's just go on to the next slide. We applied the checklist prospectively to 150 horses which were presented for poor performance evaluation. And these horses were assessed both before and after the use of nerve blocks to take away their pain. And we noted during the clinical evaluation whether or not there was teeth grinding, whether or not there was an abnormal respiratory noise, whether there was a delayed recovery of the resting respiratory rate, whether the horse sweated disproportionately, and whether the horse showed an abnormal posture after exercise. And in those horses which showed any of these signs, they were markedly reduced when we took away the pain. So that confirms to me our previous clinical observations, that we've now demonstrated this categorically by the objective evaluation of these horses. So these are all important things to be aware of. But to go back to one of my previous comments, we have to remember that it is the total score out of 24 that is important. And if it's a bad fly day and the horse keeps tossing its head and swishing its tail, we have to say that may be because of the flies, and not immediately jump to say, well, that horse doesn't normally do that, there must be something wrong. It may be due to external circumstances beyond your control. So don't panic if the horse suddenly does something abnormal. There are other things that horses do which are not included in the checklist. So bolting, for example, is not included in the checklist because we don't see it that frequently, but bolting is frequently a response to musculoskeletal pain. So just because a behavior isn't on the checklist doesn't mean it can't reflect pain. It just means that when we compared lame horses and non-lame horses, it wasn't a behavior that came out as one of the top 24. And most of the ones which came out within the top 24 are at least 10 times more likely to be seen in a lame horse than a non-lame horse. But things like bolting are often pain-induced, but some behaviors may be promoted by pain initially, but then become a learned behavior. So, for example, a horse may have some painful episode which promoted it to behave by rearing. And that is a relatively easily learned behavior. And horses can learn behaviors quickly, and to unlearn those behaviors, it may be a slow process. And if that behavior, rearing, was rewarded by the horse being given a pat on the neck and stopping work, then that is reinforcing that behavior. And if that's the only behavior the horse shows, that doesn't necessarily mean it's in continued pain. It means that there may have been pain initially that provoked that behavior, that behavior has now become, that single behavior has now become a learned behavior. So a single behavior doesn't necessarily mean the horse has got continued pain. So I guess then the other thing to remember is that we've said that it's 8 or more of the behaviors that is the threshold. If the horse does show 8 or more of the behaviors, it's an important observation. But if you're using this as a monitoring tool and your horse's scores are creeping steadily upwards, so maybe they started as 1 and then they went up to 3 and now they're 5 and then they went to 6 over a period of, say, 6 weeks, this is a really big warning sign that something's not right. And if something's not right, it's no good burying your head in the sand like an ostrich. It's better to face reality, because the sooner the problem is resolved, the more likely it is that we're going to be able to fix the problems long term without secondary problems developing.
Yeah, it really highlights for me the value of doing these evaluations as a regular course of, in the course of events, because I tell people all the time as a trainer and as a behavior consultant that you know your horse better than I do. And generally people know their horses even better than the trainer does. And it's the changes, it's the things that evolve, get better or worse over time that I think are really the things that serve as the best indicators of a problem. And so many of the things that are on the 24 behaviors ethogram, and also the additional behaviors checklist that we have available on the 24horsebehaviors.org website. So many of those are things that might be transient, might come up, like you said, might be just today. But if you're tracking on a regular basis, you're going to see those things stay the same or increase or decrease. And that's really your best practice for being able to use these tools effectively, it seems like.
Yes, I think most people who've used the checklist say they found it empowering. So if it's an owner, they found it empowering because they're convinced that their horse isn't right. They take the horse to the veterinarian and they're told there's nothing wrong. But this is a way that they can show that the horse does have something wrong. Likewise, it's empowering to say, well, it's really good. My horse is not showing a big score. It's only scoring 3. And that's kind of gives you confidence that your horse is okay.
Yeah, or the scores are going down. Yeah, that the horse is getting more comfortable. Yeah, that brings up a couple of things we've mentioned in other conversations that I think are important to reiterate. For one thing, being able to the fact that veterinarians often don't evaluate horses under saddle and how important that is. I know that's a big point that you make all the time. That if your vet isn't watching you ride, isn't watching the horse be ridden, then they don't have all the information. And this again is empowering to give you the ability to say, well, because I hear people say all the time, oh, well, my horse has been seen by a vet and they've ruled out pain as the cause. And my response to that is always, you can't prove a negative. You can't prove that there is no pain. But what are they doing to evaluate that? And if they're not watching the horse under saddle, then this gives you the ability to say, well, I know you said that he passed the lameness exam, but there's this whole area where I can give you examples of the problems I'm having and that I would like to do something to address those. And if your vet isn't interested in looking at your horse under saddle, it's probably a good idea to find a new vet. And we have free resources on the website as well on how to select a vet. We did a whole live on that as well, because it is really important that you work in partnership with your trainer, with your veterinarian, and this gives you an ability to communicate what you're all seeing. One question I had for you is, I think some people look at all of this information and they feel like their eye is not trained enough or not good enough to be able to spot these things. What would your advice be to someone who either feels like they need to get better or feels like they just don't have the capacity to spot these things?
Well, I think everybody has the capacity. You might not have confidence, but if you practice, you will get better. And we did a study several years ago when we took 10 people who had had no training. So my secretary, a couple of people that worked in the yard, grooming and mucking out the horses, an equine theatre nurse, a British Horse Society instructor, and several other people who had no behaviour experience whatsoever. And they reviewed video recordings without any training whatsoever of 21 horses, which were viewed in a randomized order. They didn't know that there were 21 horses before and after the use of nerve blocks. They were just told they had 42 video clips to watch. And some of the horses were presented before the use of diagnostic anesthesia or nerve blocks, and some horses were presented after the use of diagnostic anesthesia first. And they had no idea. They just thought they had 42 video clips that they had to evaluate. And all of the horses went through the same kind of work pattern. And the horses were also scored by a trained assessor who was well used to using the Ridden Horse Performance Checklist. And they were able to differentiate, the non-trained assessors, between the horses before and after the nerve blocks. And these were only mildly lame horses. The most common grade of lameness was only 2 out of 8. So these were mildly lame horses. So they couldn't determine by looking at the horses whether or not they were lame. They were just looking at the behaviours. And by just applying the checklist, they could differentiate with good agreement among themselves and with the trained assessor the scores that were applied to the lame horses versus the horses after the nerve blocks. So that shows that you can use this tool, even if you may feel confused at first. And there is a course available via Equitopia, which is an American-based charity, a 12-part interactive course. There's also the book, Harmonious Horsemanship, use of the Ridden Horse Ethogram to promote, optimize performance, partnership, and potential. And that book gives lots and lots of photographic examples of all the behaviors and lots of descriptions about how to use the checklist. So there are quite a lot of resources. And next year, in association with Horses Inside Out, there will be more video training available.
Excellent. That's fantastic. I think that's all we had to discuss. Oh, I have someone out texted me a question. You mentioned that there's a pattern that you've established for people to use in evaluating horses that you can ride as you're evaluating. Is that available to the public?
Yes, that's available. We can put it on the website, the 24
Absolutely.
Behaviors website.
Yep, absolutely. We'll get that up. Okay.
I would make one additional point about the importance of seeing the horses in canter. Don't assume that just because the horse appears non-lame in trot, that it's necessarily going to be comfortable in canter, because there are some sources of pain that create problems in canter and not in trot. So it's really, really important that horses are seen in canter as well as trot.
Yeah, that's a great point, because I think that's another thing that sometimes lameness exams are lacking. And we did a whole live a few months ago on the one quote unquote behavior on the ethogram that we termed canter dysfunction, because it encompasses many different aspects of canter that can be seen. And I think it's one of the more common ones as well, if I'm not mistaken.
Yeah. Okay, Megan, over to you.
Yeah.
Well, it was a really great discussion, and I think that will really help people be able to apply the ethogram in the best way and make the best use of it. So we just wanted to point out that we do have our websites where you can reach these resources. They are free. See if I can get my PowerPoint to advance here. It's not trying to cooperate with me. Where are we? There we go. So we have the free mobile field guides. So we have illustrations of these behaviors, which can also help people recognize those behaviors, because it hones in on particular aspects rather than looking at a photograph that may have many things going on, or a video that may have many things going on. So with Dr. Dyson, we developed that mobile field guide that has illustrations and descriptions of all the behaviors. We also have the free 24 behaviors checklist that Dr. Sue was really recommending. So important to keep that in hand, that you can use as you're observing your horse and keep track of things over time. We also have the free additional behaviors checklist that includes the other behaviors that Dr. Dyson was talking about here today, as well as many others that will probably seem familiar to many people as you look through some things that you've seen with your horses before. And Jody also referred to the Selecting a Vet checklist. We have that blog again on our website, the video conversation on the YouTube channel. You can get to that from our website. And the checklist can also be something that you use when you're looking for a veterinarian to help you out. So again, we are a nonprofit organization, and if you are appreciating these free conversations as well as these resources, feel free to donate to us, and that will help us produce more content for everyone to have access to this information. We want to also get this moved out of the way here, want to really highlight that Dr. Dyson and Kath Lauritsen of Padma Video have produced a new film that is for free again on YouTube, Horses and the Science of Harmony. And it's an excellent film. It goes into a lot of depth about many of these topics that we discuss in our conversations with Dr. Dyson and interviewing many other researchers and it's a great film. So we wanted to make sure if you haven't seen that, go ahead and check that out.
I think a lot of people are watching it. Last I looked, it had something like 58,000 views in just a week and a half. So
Yes,
people are
yeah,
really a lot out of it.
yeah, it's really, really getting the word out there, which is so great to see. Again, Dr. Dyson's book that she co-authored with Sue Palmer is available through harmonioushorsemanship.co.uk. Also, you can get that book via Amazon, and be a really great partner for you as you're working with the 24 Behaviors Ethogram.
I got a lot out of that book. It makes a great Christmas gift.
Yes, here we are coming up on the holidays.
Yeah.
For the horse lovers, you know. And with that, we will preview our next conversation. Will be coming up on Thursday, December 12th, and we are going to discuss the very important topic of nose bands. So we look forward to all of you joining us again in a few weeks, couple weeks, for a great important discussion about this very controversial piece of tech. And with that, we will sign off. Dr. Dyson, wanted to thank you again, as always, for joining us and lending your time to help ensure all of this information reaches people who work with horses and therefore benefits the horses that they care for, as well as the people.
You're very welcome.
All right. And with that, we will see you all next time.